We offer the full spectrum of care and treatment. That care and treatment has been specifically designed to meet the needs of the local communities. We offer specialist nurse-led care to specialist consultant-led care for the full adult range from 18 right up. We have worked hand in hand with the NHS and local authorities to design the services that they want. And this all ties back into the training and development we do with staff. We make sure that they have the capability to assist these people towards a full as life as possible.
It's through person-centric care and having a dedicated team, staff with knowledge, so that we can make sure that all our care, be it physical or mental health care, is tailored to that service user. It's looking at the person as an individual and not just a set of symptoms.
Well, we look at what's worked in the past for them. We involved a multidisciplinary team here with the psychiatrists, psychologists, occupational therapists and nurses, and we also involved the home team as well in formulating the plan for the way forward and supporting the individual to get back to the community as quickly as possible.
We work with our patients with mental health difficulties to lead meaningful and fulfilling lives through activities and occupations that are really important to them. We've got a walking group, a music group, art sessions, craft sessions, a breakfast group, but how someone engages in that activity is completely specific to them.
The quality of the relationship between the client and the service is at the core of what we do. Without a good therapeutic relationship, you really have huge limitations on the therapy and the treatment and interventions that you can provide for people. All of our interventions are well researched and based on the latest evidence in the field.
For many of our service users, this will be their forever home. We work in their home, and that's something that we never forget. We've got very high standards for all of our service users. We want the best for them, and we ensure we do get the best for them.
Hospital, I hope, has a warm and intimate feel, not just the way the building is designed and the way it is, but actually we have lots of good relationships amongst everyone, not just in the clinical team, domestic staff, people working in the kitchens, etc. Internal team working combined with people just being kind, people being kind and considerate.
A very creative approach. We have psychological formulation underpinning what we do, so using alternative methods in terms of using equine assisted therapy, for example, are key ways that people can actually feel safe and engage with treatment that perhaps they may have been resistant to before.
One of the interesting things that we do at Surehaven is the education programme provided by our psychology team. It's delivered to staff at all levels. So from our healthcare support workers to our cleaning staff, our catering staff, to the nurses and other therapists. We deliver a package that's been recognised as one of the best in the sector.
Services and staff teams are often not supported and not equipped with the skills and knowledge to feel confident to deal with trauma. So we adopt a trauma focus model and we approach it from predominantly a compassionate mind-based therapy perspective. That's something that's used to help the staff team to look after their own emotional well-being, because that's an integral part of them being able to then be supportive to our client group. It's person-centred working. You really get to know who they are, who they were before they came to hospital and who they hope to be in the future, and it's just lovely to work with them throughout all those different stages and help them to achieve their goals. Even just to see those small baby steps, not even as something as big as going back out into the community, it's just lovely to be involved in that process.
Just that people here care. People are very, very motivated to really get people better, to be able to help those individuals that perhaps have not had access to certain kind of therapies in the past or a certain skill set in the past.
One story I think really sums it up, what Shaw Mental Health is all about. As a service user who was resident in Glasgow, she'd been part of mental health services since the age of 17. Spending 15 years class as a failed patient. She came to Glasgow, she was there for 3 years, and for the very first time she made progress. She made this progress due to us working with her, not just cold clinical goals, but her own hopes, her own aspirations. This young lady is now living independently in the community, working as an advocate for young girls with self-harm problems. This really does sum up exactly what we want to do in Shaw. We want to put the person at the centre, work with them and improve their lives.